Okay. Well, we've had great interest in this webinar, and I want to make sure we get going close to the top of the hour. For all of you who are with us, do know that this is being recorded. And good afternoon, and welcome to the second session of the 2020 Virtual Clean Med Series. I'm Jessica Wolf. I'm the U.S. Director of the Climate and Health Program at Healthcare Without Harm and Practice Green Health. And it is my pleasure to be moderating this session today. Today, you will hear about a project undertaken at MedStar Harbor Hospital, located in a low-income Baltimore neighborhood, that used trees and plants, a whole lot of them, to not only address stormwater runoff, but also to address other climate change impacts and support the health of the community. You will also learn about the Arbor Day Tree Campus Healthcare Program, a program we helped Arbor Day develop, which provides guidance and recognition for healthcare facilities that use trees to help improve health outcomes. And before we jump into the topic at hand, I just wanted to encourage you to mark your calendars for the remaining sessions in our Clean Med 2020 series. While we look forward to future years when we can connect in person, we recognize that the challenges we are all facing today with the COVID-19 pandemic. So we have made a decision that for Clean Med 2021, we will also be all virtual. We'll be sharing more details in the coming months, and we really look forward to your participation in the Clean Med 2021 experience. Oops. Hang on there, sorry, a little technical glitch. Going the wrong way. Here we go. Okay, so I am really pleased to have three wonderful speakers for our session today. Joan Plisko is the president of Plisko Sustainable Solutions, a woman-owned micro business that creates customized sustainability programs for triple bottom line results. Prior to starting this business, Joan worked as an environmental health and sustainability director, a strategic planner, researcher, and educator. Brian Gray is the Director of Clinical Engineering and Environment of Care and the Sustainability Officer for MedStar Harbor Hospital. Brian manages the biomedical equipment, emergency preparedness, safety management, and hazardous waste programs, and works closely with a core group to accomplish key environmental goals. Dan Lamb is the president of the Arbor Day Foundation. During his 15 years with the organization, Dan has led the development of innovative programs that expanded the organization's global reach. He heads a group of corporate leaders who are dedicated to helping the foundation meet its Time for Trees initiative to plant 100 million trees and inspire 5 million tree planters by 2022. We are going to be holding Q&A after all three speakers present. And if you have questions for the speakers, you can submit them anytime you would like through the Q&A feature that you'll see at the bottom of your screen. For other comments or other technical issues, please use the chat function. So without further ado, I will pass the baton over to Dan Lamb.
Thank you, Jessica. And thanks for the opportunity to be here today. I appreciate it. As you mentioned, my name is Dan Lamb. I am president of the Arbor Day Foundation. And I had the opportunity to be at the Clean Med conference last year in Nashville. It was my first time to the Clean Med event, and it was fantastic. I was blown away by the content, the people there, and to learn about the work in sustainability in the healthcare field is impressive. And so thanks for the opportunity to be with you again today. And I am going to share a little background on the Arbor Day Foundation, and then talk about our Tree Campus Healthcare Program, which we're very excited about working with Practice Green Health on. But first of all, the Arbor Day Foundation, for those of you who are not familiar, we are an international non-government organization. We're a nonprofit. We were founded in 1972 on the 100th anniversary of the very first Arbor Day. And we have a very simple mission. We inspire people to plant, nurture, and celebrate trees. And that's what we do. And it is a pretty great job because everybody loves trees, right? I think everybody has some kind of memory of trees. Maybe it's the first time they ever planted a tree with their school or their grandparents or their parents. Maybe it's a favorite tree-lined boulevard that they walk their dog down on a hot summer day. Or for some people, it's just the romantic notion of a forest. People oftentimes don't have the opportunity to get into a forest, but just the romantic notion of this forest, there's this innate connection and love that people have of trees. So it's great for us at the Arbor Day Foundation for sure. But at this time, in this moment, we believe it's time to go beyond memories and beyond nostalgia to action. And that's why several years ago, we introduced our very first vision statement, and that is that we're going to be a leader in helping increase the recognition and the use of trees as a solution to some of the biggest issues facing the nation and facing the globe. And anybody who has turned on the news or pulled up their smartphone to pull the news up has seen we have a tremendous amount of work to do. We've all read about or seen firsthand, unfortunately, the historic fires in the western part of the United States that have been going on for the past few weeks. Millions and millions of acres of forest lands burned, destroying trees, not just in forest lands, but in communities also. And unfortunately, these fires are not just in the western part of the US, they're all over the world, and it's a growing challenge. We've seen how it hasn't just been hot where you live, it's been hot where I live, it's been hot everywhere. Last 5 years have been the hottest years on record, and those excessive temperatures are creating a real strain on people and communities and trees. And we've seen the increasing frequency and severity of natural disasters like tornadoes and hurricanes and floods damaging and destroying trees. And unfortunately, this list just goes on, and that it's creating immense pressures on communities, on people, and on forests. And that's why we say, if ever there was a time to be planting trees, that time is now. If ever there was a time for our collective leadership and work, that time is right now. And health and wellness is a growing and increasing attention area in this issue, because there are real serious issues facing communities and facing people. From air pollution and the growing challenges we're seeing with pollution in our air, to mental health and depression, to the extreme temperatures that I mentioned, to the increasingly sedentary lifestyle that we're seeing, not just in our youth, but in adults as well, all around the country and around the world. Fortunately, trees and forests can be a part of this solution. They are not the only solution, but research again and again tells us that trees and forests can be a positive part of a solution for many of these challenges. Solutions like air pollution. Trees and forests are a natural filter for pollutants, removing millions and millions of tons of pollutants from the air every single year, not just in our cities, not just in our forest lands, but everywhere. We know that trees and forests, many of you have experienced this in your own lives, they have a calming influence, a healing influence. There's a great growing list of research that talks about how trees and green space can help to create calming environments and help to address and support some of the health effects happening across the country. I talked about the excessive temperatures. We know that tree-lined boulevards and parks can reduce daytime temperatures by up to 10 degrees Fahrenheit, creating safer communities for our families, for our children, for everybody. And neighborhoods with high tree density are healthier. Research tells us that neighborhoods with high tree density are 3 times more active, the residents are, than neighborhoods that don't have high tree density. There's a lot of momentum, a lot of excitement. Over the last several years, there's been unprecedented amounts of research discussing the urgency for trees now, not just around climate change, but around issues like health and wellness. So as a way to encourage this and support this and enable the use of trees as a way to address health and wellness and sustainability, the Arbor Day Foundation last year was excited to announce at Clean Med the introduction of a brand new national program called Tree Campus Healthcare, a brand new recognition program to celebrate leadership in wellness and community engagement through trees. We want to shine a light on hospitals and healthcare facilities that are managing trees and using forests and green space as a part of advancing health and wellness. This is a big new program for us. We worked for a few years with Practice Green Health, with other hospital sustainability leaders and teams. We worked with state forestry agencies, city forestry leaders. The United States Forest Service was very involved in the development of this program. And we're excited about having a national platform to shine a light on hospitals and healthcare facilities that are doing it right. Now, for any facility who wants to be a part of this program, there are 5 core standards that have to be met as a part of the application process. And those 5 core standards are right here. They include, number 1, an advisory committee. Hospitals will have to pull together an advisory committee, a mix of the community and folks who work at the hospital, to help advise and counsel and put plans together for how they're going to be using trees and forests in their work. Number 2, a facility tree care plan. This is about making sure that there are rules on how we're going to plant trees, where we're going to plant trees, how we're going to care for the trees, and what the strategy is and how it lumps into the broader campus and community sustainability efforts. The 3rd standard is a community forest project. We want hospitals to recognize the leadership role they play in their community, and nature-based solutions and trees and forests is a part of that. So whether this is an event in their community that they serve, in the neighborhoods they serve, or on their campus, engaging the community in a forestry-related project. 4th is celebration and education. Again, hospitals are leaders in communities. This is a unique opportunity to shine a light, to toot their own horn a little bit, and show they're doing really positive things through trees and forests with communities. And finally, a financial investment. We can't just say we're going to do these kinds of things. We want this work to endure. So like with any sustainability initiative, we want to make sure there's investment. And there's not a specific limit on what hospitals or healthcare facilities need to commit, but we want to make sure that they are prioritizing the trees and forests as a part of their broader initiative. So these are our 5 core standards. And what we believe, they are flexible and adaptable, but they're important for a high quality, sustainable program. And we are seeing a lot of attention, a lot of enthusiasm, as we're seeing leaders in health and leaders in sustainability holding their hand up and saying, we want to learn more and we want to participate. They see the co-benefits that trees provide. It isn't just creating a beautiful campus, it's creating a sustainable community and a healthier community. Through this program, we want to celebrate and spotlight leadership in sustainability, our collaborators who share our mission in this space. And while we launched this last year, we are very excited about the traction and the growth it's already seen. We are excited that 16 hospitals and healthcare facilities were recognized as the first class of the Tree Campus Healthcare Program. These are institutions that include public hospitals, private hospitals, veterans hospitals, nursing and assisted care communities, all kinds of different hospitals and facilities who are recognizing that this is another way to demonstrate their leadership in sustainability and wellness. And we encourage all of you to think about how you might want to apply to be a part of the Tree Campus Healthcare Program and tell your story. Any provider of inpatient care is eligible to be a part of the Tree Campus Healthcare Program and be recognized. Before I pass it over to Brian and Joan, I want to make sure that I have the opportunity to thank Practice Green Health for their leadership in helping to develop this program, grow this program, and grow awareness of the importance of connections between trees and sustainability and wellness. So as I pass over a great story from Brian and Joan and MedStar, it's a great example of how trees and leadership from this hospital is advancing both health and wellness, sustainability, and educating staff in the community. So with that, I pass it over to Joan and Brian.
Good afternoon, everyone. My name is Brian Gray, and I am the Director of Clinical Engineering and Environment of Care at MedStar Harbor Hospital. I have many different hats that I wear here at the hospital, and one that I'm very proud to wear is a Sustainability Officer representing MedStar Harbor. We have been a member of Practice Green Health since 2006. The project that we're going to present to you today aligns with not only our corporate, but our community initiatives. And it is with great pride that we partner with the innovative Joan Plisko, which we've done for over 15 years. So we're very, very proud with the relationship that we have with Joan and her company. Next slide, please. So I'm going to give you a little bit of information about MedStar Harbor. So as you can see on the right-hand side, it's a fairly large campus. So we are a city on city property, and we are a waterfront property. We're on the middle branch section of the Plisko River, which is a contributory to the Chesapeake Bay. Our waterfront location allows us to draw very large crowds on an annual basis several times a year. For such events as Independence Day fireworks, our Maryland Fleet Week air shows, the Tall Ships Regalia. Of course, all of these are on pause right now due to the pandemic, but nonetheless, thousands of people come to our campus. The hospital is also on the Gwens Falls Middle Branch Trail, which is a fabulous trail that runs along the water's edge of the property, allowing folks to walk, bike, and run safely through the communities. And throughout the year, the hospital conducts tours on our campus to educate visitors about our environmental stewardship and the importance of protecting the Chesapeake Bay, highlighting our program and our project that we're going to share with you today, engaging organizations such as the Masonville Cove project that's just around the bend from the hospital along the water, living classrooms, along with the National Aquarium, which is in downtown Baltimore. Next slide, please. So the hospital does a needs-based assessment every 3 years. It is managed by our innovative Ryan Moran, who's the director of our community benefits. MedStar Harbor is within the community of Cherry Hill, which is a very historic African-American neighborhood in the United States. And there's been a long history with this neighborhood of public neglect throughout Cherry Hill. Large disparity in the median income of the Cherry Hill residents to that of Baltimore City. And the neighborhood itself is rather cut off from the main city due to major thoroughfares like Interstate 95. But nonetheless, we still take very much pride in engaging the community through councils and dialogue, the Black Yield Institute and the Cherry Hill Urban Garden Association, as we keep touch with them. Next slide, please. We're very proud that the 2018 Community Needs Assessment birthed what you see now here on screen, which is our brand new mobile health center. This center went live this month, and we'll be addressing primary health service needs, connecting resources to behavioral health screenings, rapid HIV, and diabetes maintenance if needed. And the Mobile Health Center is has bi-weekly stops to 8 strategic locations within the communities that we serve in Baltimore City and Northern Anne Arundel County. And with that, I'm going to turn it over to Ms. Plisko.
Good afternoon. Thank you, Brian, and thank you, Dan. As Brian indicated, MedStar Harbor Hospital is located in the urban environment of Baltimore City, where residents are subject to one of the deadliest forms of extreme weather in the United States, which is heat. And that kills an approximate 12,000 people each year, a number that is certain to rise because of climate change. And heat is especially common in low-income neighborhoods, as Brian described, and in neighborhoods that have a large percentage of residents of color. In Baltimore, this correlates to neighborhoods with less tree canopy. These two maps on the slide, on the left map, the dark green represents increased tree cover, and on the right, dark red represents increased heat. What we see is that the light green, or the white on the left, which indicates less trees, maps to the dark red or the orange on the right, which indicates higher temperatures. And the blue dot indicates where MedStar Harbor Hospital sits. Now, storm surge and sea level rise are also indicators of climate change, and MedStar Harbor Hospital, as Brian shared, literally sits on the banks of the Patapsco River. Shown in this slide are flooding events in downtown Baltimore from the past couple of years. One assessment predicts for Baltimore a 4.2-foot rise by 2100 from a 1992 baseline. And that's in my children's lifetime. The same study predicts a 12% risk of at least one flood exceeding 6 feet every year from 2016 to 2030, and a 100% risk by 2100. So as healthcare providers, we have to be ready. Green infrastructure, especially in urban environments, is a critical piece of a comprehensive strategy for addressing the impacts of climate change. And green infrastructure relies on vegetation, on soils and natural processes to manage water and create healthier urban environments. There's some examples listed on the slide. Now, interconnected networks of green infrastructure can enhance community resilience by reducing flooding, reducing heat island effect, and improving water quality. Just a few words about Plisko Sustainable Solutions before we get into the details of this project. We celebrated 5 years as a woman-owned small business this past February. We launched this company after I spent 10 years as a director at Maryland Hospitals for a Healthy Environment. I'm happy to say that MedStar Harbor Hospital was the first hospital I worked with in that capacity. And so for over 15 years, I've been working in the field of healthcare sustainability, among other things. So this project started with a proposal I wrote in 2014, 6 years ago, to the Chesapeake Bay Trust in partnership with Blue Water Baltimore and the Neighborhood Design Center. At that time, the proposal was focused on increasing the knowledge and behaviors of hospital associates and green team members, and looked at the issue of stormwater runoff to create a green infrastructure master plan. Together with the Baltimore City Department of Public Works on our team, we accomplished this and so much more. Here's a spoiler alert. This plan led to a design grant followed by an implementation grant where we received over $1.3 million. MedStar Harbor Hospital had been working in the sustainability realm for well over a decade when I approached Brian with this concept. And two things made this an easy sell. The first, the previous impervious site conditions, as shown on this slide, led to regular flooding and standing water during heavy precipitation events. The second was executive leadership understood the magnitude of the issue and the connection between stormwater, flooding, health, and resilience. So a big thanks to Jill Johnson for being the executive sponsor, and of course to Brian for being the boots on the ground that got this project done. So after getting buy-in from executive team, we started an education process targeting members of the green team. We surveyed folks, we toured the grounds together, and then we developed a values matrix to rate different scenarios, and we ranked them based on the team's prioritization of criteria. I did some research on the health and wellness benefits related to green infrastructure, and we created signage that was posted in prominent places around the facility and used for tour groups such as the Choose Clean Water Conference, which had an outing to tour the hospital grounds. This is my favorite picture. I took this picture last month, and it's one of the healing garden behind the hospital. So it's on the back side of the hospital. Patient rooms look out over the gardens with the river in the background. And as Dan alluded to, being in nature, even seeing nature and the natural world, boosts focus and memory, enhances happiness and healing, reduces stress and anger, promotes social behavior. So folks that work at the hospital and in the community and that visit the hospital traverse this every day. Now this shot is in the front of the hospital, where staff and visitors and patients are likely to drive by or walk on their way to the hospital. One of the aspects of this picture that I really appreciate is that the bioswales were built as companions to the mature tree canopy. And what we know, again, echoing what Dan said, being in nature is great for physical health. Research shows it reduces obesity and type 2 diabetes. It improves immune function. It lowers blood pressure and risk of heart failure, and reduces heat-related illness, especially in a high heat city. One of the most important aspects of green infrastructure at healthcare facilities is the positive impact on patient outcomes. Being in and seeing the natural world, trees and plants has been shown to reduce the length of patient stay, increase patient recovery time after surgery. It leads to less need for pain or anxiety medication. And the research also indicates that mothers who spend time in nature have children with increased birth weight and have a lower risk of delivering a preterm baby. Being in and seeing the natural world also increases patient and family satisfaction, as well as staff satisfaction and retention. With all of that as a basis, I want to pass this on to Brian to talk about the design and the implementation.
Thanks, Joan. So as we get started, I wanted to share that, our initial design grant was provided to us by the Chesapeake Bay Trust, followed by the Build grant, which was provided to us by the Maryland Department of Natural Resource. What's interesting about the grant from the Maryland DNR is it's the first time that they've ever worked with a healthcare organization. And the grant that we received, as Joan mentioned, over $1.3 million, was the largest grant that they've ever supplied to an organization. So with great pride, we accepted their money. Next slide, please. Our project had an anticipated completion of fall of 2018. We actually finished in winter of 2018. I'll explain further on why that was. We're very proud to partner with small businesses and nonprofits within the region to complete this project. The darker green sections of this map show the planned areas to capture stormwater, which flows into the lime greens sections, which are bioswales as well as bioretention ponds. This project also included 5 rain gardens. And then the third green depicts the healing gardens on the back lawn that Joan showed you earlier. Next slide, please. Here's just a breakdown of the project in general. Our project captures over 5 million gallons of stormwater runoff each year that we're treating before it enters the Plisko River. Over 48,000 perennials, shrubs, and trees were planted in the project, and over 5 acres of impervious surface are treated as part of this stormwater project. There are 2 bioswales, 3 bioretention areas, 4 micro-retention practices, and a total of 5 rain gardens. Next slide, please. Preparation for planting of the beds and shrubs began here. As you can see on the left-hand side, we began planting our trees. Upwards to 60 trees were part of this project. On the right-hand side, you can see the heavy equipment starting to build the bioretention and the bioswales. Next slide, please. This slide is depicting on the left-hand side, these are the bioswales. Upper left, the bioswales on one of the largest portions of our parking lot, and all of the plants being staged to go into the project. Lower left hand shows another large portion of the project. This at the end of one of our visitor and patient parking lots. And on the right-hand side, the front lawn project, as Joan mentioned, not a single tree harmed in the build of the project. And to this day, they're still thriving. I was concerned about root disturbing as we were digging and installing, but none of the trees were lost during this process. Next slide, please. I love this slide most because the upper left-hand shows the massive turf that is now the rain gardens, the 5 rain gardens. So we know that turf just does not remove and filter as much stormwater as native plants do. The lower left-hand side showing all of that turf is gone and the plants staged. Missing right now in this photograph are the benches that we installed for folks to sit in the rain gardens and not only enjoy the gardens, but also enjoy the Plisko River. On the right-hand side, we're showing the top right is the lawn before we removed it to install the healing gardens. And then on the lower right, you can see the 4 sections of the healing gardens that we installed. Next slide, please. On the left-hand side, you'll see prior to the bioretention pond being added, massive turf, as well as a great deal of asphalt. And I'd like to draw your attention on the left-hand side of the stormwater drain that you see there. That drain actually we kept. There are a total of 2 of them along this curbside, and that drain is acting as the overflow for this project, which you'll see later on in the slide. The right-hand side shows the project completely built and thriving with the plants. Next slide, please. This is the front lawn of the hospital on the left-hand side. Again, the current tree canopy that was in place and none that were lost due to the project. Again, expansive turf, lots of turf. On the right-hand side, the completed project installed and thriving with all of the plants and shrubs installed. Next slide, please. I really enjoy this photograph. This is our satellite parking lot. The left-hand side shows all of this unnecessary impervious surface that is asphalt as it led up to the shrub line and then the curb. The right-hand side shows the completed portion of the bioswale project. What a difference. All of this asphalt, unnecessary asphalt gone. This bioswale is capturing a great deal amount of water, leading it to a bioretention pond that you'll see in a next slide. Next slide, please. So this is that same lot that you just saw. On the left-hand side, you'll see the bioretention pond. It is filled with water, and it is filled with water because not everything went well during the install of this project. This pond was compacted too tightly and required remediation. So our vendor came in, pumped out the water, remediated the soil, and once that occurred, added more sand, of course, and once it occurred, the project is draining within 72 hours. It actually drains within 24 hours, which is excellent. On the right-hand side, we did run into a snag. This piece of our property used to be a Ford dealership, and we found undocumented storage tanks that were underground, smack dab underneath the bioretention portion of the project. Fortunately, the tanks were intact. There was no spillage. The majority of the tanks were filled with stormwater, rain, a little bit of engine oil. We worked with the EPA, and within 2 weeks, we're able to not only remove the tanks and have them properly disposed, but the soil was tested to assure that there was no contamination before the bioretention ponds were built. And with that, I will turn it over to Joan.
Great. Thank you, Brian. In addition to the installation of all the trees and plants, educational signage has been installed across the campus. to ensure that patients, staff, and visitors know what they're seeing and understand the benefits to the environment, to patients, to the adjacent river, and to the planet as a whole. Each sign has a different topic. This one is on tree cover. Other topics are pollinators, rain gardens, impervious surface removal, and healing gardens. And our partner, Blue Water Baltimore, helped create the signs. They're a local nonprofit that works to restore Baltimore's waterways. What I like about the placement of this sign on climate resiliency is that it's in a highly visible spot near the front driveway to the hospital. Now, our team discussed creating signs that were in multiple languages and considered QR codes for linking to a website with more information. However, our budget didn't allow for this. It is something that we would consider in the future. MedStar Harbor Hospital has hosted a variety of tours, such as Project Green Classrooms on the bottom left, which is a statewide initiative that promotes outdoor learning and discovery. And then MedStar Hospital was a tour option for the Choose Clean Water Coalition, a group which harnesses the collective power of over 250 groups that advocate for clean rivers and streams. As Brian mentioned, the benches are an important aspect too for community members, for staff to enjoy, and the open green space, as Brian indicated, is used for anything from holiday fireworks to Blue Angel flyovers during events where people are allowed to gather. The outdoor patio and green space between the hospital and the Patapsco River are excellent spots for staff and community programming. And so with the green team, we brainstormed ideas for connecting to folks. Sorry about that. There we go. For connecting to folks. Shown here, we divided into 3 categories: learning, well-being, and hands-on. Now, we were slightly derailed by COVID-19, and we expect to move forward when allowable. As an example, last fall, the Green and Wellness team hosted MedStar Harbor Hospital's first relaxation training seminar for associates. Now, this type of activity outdoors helps to decrease stress, lower blood pressure, improve sleep and well-being, and enhance focus. We encourage folks to highlight and share their experiences. This is a shot that includes a goldfinch, which I saw while walking through the bioswales just last month. The enhanced tree canopy and the plantings really entice a lot of birds. We've even had interest from the Audubon Society to host bird watching outings here. So with the Green and Wellness team, we also developed simple language that we believe resonates with folks and that could be used when explaining the beautiful gardens and the benefits of being in the gardens. So finally, we looked at different methods of communication to get the word out about the health and wellness benefits of being in nature and exploring the campus. And of course, with COVID, things have shifted, and we look forward to them shifting back. With that, I want to pass it back to Brian to bring it on home.
Thank you, Joan. So this slide is an example of our hospital newsletter that we produce on a weekly basis. And through the project and learning the health benefits of nature, we decided to merge the green team with our wellness team. So MedStar Health is very robust with a wellness committee, and we felt it necessary at our hospital to merge the two. So out of the merger was born the Green and Wellness team, and there's our brand new logo shown here on the newsletter. So we're very, very, very proud of that. We also partner with an advisory council. So on a monthly basis, the hospital meets with not only key hospital volunteers, but also community volunteers who are patients here at the hospital, and how we can better improve our services to the community and share with them the necessary health and well-being aspects of nature. Next slide, please. So what we're considering next is we just recently submitted a grant to the Chesapeake Bay Trust to install a green roof. This green roof overlooks the healing gardens on the back lawn and is visible from our second floor all the way to our 7th floor. So a great deal amount of patient rooms would be able to overlook the green roof if we're lucky to garner that grant. We're also exploring solar panel carports on our patient and visitor lots, which will have the ability to charge electric cars through EV charging stations. And we're especially proud to partner with the South Baltimore Gateway Partnership as we submit a grant to explore the installation of a living shoreline. Next slide, please. And last but not least, we are excited that we plan to throw our hat into the ring to be on that long list that Dan showed earlier to the Arbor Day Foundation Tree Campus Healthcare. As of this spring, 100 trees have been planted on our campus since 2018, with 25 more planned in the month of October and November. So we're very excited to be working on our application for that. Next slide, please. And with that, we are very pleased that you were able to join us today. I am thrilled to be able to co-present this with Joan. Thank you so much for your time.
Thank you so much, Dan and Brian and Joan, and we're going to go to some questions now. We got some great questions from participants. So first one is to Brian. Did you have any internal resistance to this project? And what benefits did you focus on when you were selling this initiative to leadership?
Fortunately, we had total buy-in from our executive leadership team. I think because of our robust community health programs that we have here, and the ability from our partners that helped us build this project, all of their questions were answered. I don't remember any fears at all. There were lots of questions, to say the least, but I don't remember any fears whatsoever. And I'm sorry, could you repeat the last half of the question?
Yeah, the first thing was about it was a resistance, and then what benefits did you focus on when selling this initiative to management?
The benefits were the fact that we did not know that we weren't using Baltimore City's stormwater management system, that we were actually, the majority of the stormwater from our campus was being placed directly into the Plisko River. And we just feel the need to be good stewards to do our share to clean up the Plisko River by installing these stormwater bioretention systems. So that was the driving factor for us. Great.
And while I have you, Brian, there was a question about ongoing maintenance costs. So the attending understands that maintenance is typically easier than turf, but it's not a no maintenance situation. So tell us a little bit about the maintenance plan in place, including costs or the cost benefit versus what you were doing previously.
So I will say that during the planning and build, we were afforded quotes on what each bioretention and healing garden project would cost us on maintenance. There was thought that it was a lot cheaper to mow lawn, or it would be in our benefit that we didn't have lawn to mow any longer because the gardens are in place. But we did find out very quickly, and not unsurprising, that there are costs in maintaining these systems, and that comes from monthly maintenance for weeding, annual mulching, The curb cutouts require collect sediment from the parking lots, and the sediment, it's very important that the sediment does not infiltrate the bioretention ponds. And so a very expansive maintenance document was provided to us prior to build so that we could review exactly what maintenance was required for all of these systems. So we then put it out to bid, and we had 5 bids on the project. And we're very pleased with our current maintenance provider, who I'm happy to say actually helped build a portion of the project. They built all of the rain gardens and all of the healing gardens. So they're very intimate with the project, and they've done a phenomenal job.
Great, thank you. So, question for Dan. Is the Arbor Day Foundation providing any guidance on how to handle invasive species that are killing trees? Ash borer beetle, lanternfly, etc. These species are forcing the removal of many mature trees, particularly on the East Coast.
It's a good question, and it's one of the big challenges we're facing across the country. There are disease and pests that, as I mentioned, are damaging and destroying millions of trees. The Arbor Day Foundation has advice we can share on that, but the other thing we are helping to do is provide local contacts. So, for example, the Maryland Department of Natural Resources isn't just a great resource to MedStar as a potential grantor, but also expertise in forestry and forest management and the right tree in the right place at the right time for the forests of the future. And so we are helping to share those kinds of connections, that kind of advice, both public and private support in that area. But one of the other benefits of the Tree Campus Healthcare Network is just this kind of conversation, that peer-to-peer conversation, as leaders from one hospital are able to advise another hospital, and that's one of the benefits of the network as well. We have lots of information on our website about how to care for those trees, how to replace trees, but we are also happy to help make personal connections to public and private advisors that might be able to help.
Great, thank you. So Joan and Brian, there were several questions about the funding for the project. So let me try to pull some together. People are interested in who was the grant writer. You've mentioned a few grants. So, was that internal to the hospital? Was that in partnership? Was that, Joan, you as a consultant? And were any community benefit dollars used to support the project?
I'll start with the first part. So the first grant, the planning grant to the Chesapeake Bay Trust, I wrote while I was finishing up at the Maryland Hospitals for Healthy Environment, and I wrote that in partnership with Blue Water Baltimore and the Neighborhood Design Center. When we got to design and implementation, Blue Water Baltimore and Harbor Hospital took the lead on writing those grants. And the community benefit piece, I'm going to toss over to Brian.
We did not use any community dollars. It was fully funded through the grants.
Wow, so there was no cost to the hospital.
Well, $90,000 to remediate undocumented tanks in the ground. Our contractors hit a water line that the Miss Utility folks missed, as well as 3 electrical lines feeding parking lot lights. So we did incur quite a bit of expense, unexpected expense during the build of the project.
Plus all of Brian's time. He spends some part of every day. He's emotionally connected to this project in a beautiful way.
Yeah. My former boss put it best. She said, "This is your legacy." And I just love that she said that.
Yeah.
So lesson learned, if other hospitals move forward with a project like this and would be lucky enough to secure grant funding, you do need a little bit of reserve for unanticipated costs along the way. You need to think about maintenance costs and how those will stack up going forward.
Right. I mean, you absolutely, you hope to rely on the Miss Utility companies. I don't know what to say. They were completely wrong in some areas of the hospital. There was one section of the project that we actually spent $22,000 of our own money. So retaining walls were built to hold as part of the bioretention, and they didn't look so pretty when they were finished. It was just a concrete wall, stained, and our hospital president at the time said, "I don't like this wall like this. Do something." So we were able to find the original quarry that was still in production in Baltimore City. The stone that's used on the facade of the hospital was also then purchased to reface this bioretention wall to pull the beauty in of the building to the project. But yeah, you definitely got to dot your I's and cross your T's.
So the next kind of set of questions, we've gotten a lot of questions about metrics, but in different ways. And I would open this up to all three speakers. So, you know, how are we showing the benefits? Both, you know, there was a question about stats to show the overall success for the project. Now, you know, there weren't necessarily upfront costs because of the grants, but that could be something people would want to look at. There was a question about, you know, looking at water use, maybe the water use, the costs, the relationship to the stormwater management before the project. And then the health benefits, you know, and Dan, I'm not sure what, you know, Tree Campus Healthcare is thinking about how we start to look at connecting those dots. And then, I know this is going to be a long question, but I'm trying to wrap a few in here. Once we have some sense of the impact of these projects, bringing that to policymakers, bringing that to others, so that we can get more funding and more interest in projects like these. So who wants to start with that very meaty set of questions?
I'll start with the water piece. So we were fortunate that we worked with phenomenal environmental engineers who designed the system. Through their measurements and their equations, you know, they came up with the amount of the 5 million amount of stormwater that we would be remediating based on where these projects were being installed on the campus and the impervious surfaces that we were capturing. Including that one of the bioretention cells had to be enlarged because just before build started, they realized that there were some miscalculations, and while it didn't cost any more money, we did have to give up, or we were asked to give up 10 parking spots. This is a very large visitor and patient parking lot. These spots were rarely filled. It was a no-brainer for us just to give them up, but through all of these equations, this is how our engineers came up with the amount of stormwater that we would be cleaning before putting it in the Plisko River. And they come back periodically and especially during storms, because they want to make sure that the bioretention systems are filling properly, but also not overflowing into the overflow drains. Now, I will say that the overflow drains are in place for a reason, and they have been in use, but they want to measure how much water is actually overflowing and not being treated, and are the bioswales large enough, the bioretention ponds large enough? And through their repeated visits to our campus, they have determined that they hit the mark. They're large enough. They're doing their job.
Yeah, I want to take a minute and also talk about the difference between transactional and transformational metrics. When we got the initial grant to do the planning, we did a survey to the green team we were looking at knowledge, attitudes, and behaviors about stormwater and green infrastructure. And we did a pre and post survey to gauge knowledge. And so what this project has done on that level, which is pretty transformational, has provided this knowledge and has changed attitudes and behaviors about what is stormwater, why it's important for us to care about it, and how it's connected to health and resilience. So absolutely, I think metrics and numbers are important, but also is that harder to quantify transformational issue of how people's attitudes have changed and how they bring that knowledge home. So it's not at the facility, but it's a life lesson.
And I'd like to add, that was perfect, Joan, but you know, the hospital sits between Middle Branch Park and Cherry Hill Park. So these are Baltimore City parks that flank the north and south side of the hospital, and the parks have parking lots, and these parking lots are flooding. And we, Blue Water, all of us combined who were building the project, approached Baltimore City and said, hey, this is what we're getting ready to do. Would you be interested? Because we have proof and pictures to show you how your property is flooding. And they said no. And now that the project is 2.5 years old, they've come back and said, we want to do this.
So let me
the influence.
That's great. Thank you. And Dan, I know you wanted to also weigh in here, and then we're going to have to wrap it up, and we will send answers to the questions we did not get to.
Well, simply, metrics are critical. Any sustainability professional knows that it isn't just a nice to have. You have to be able to document why we're doing these things. And with the Tree Camps Healthcare Program, we are not prescribing what those metrics need to be. We're encouraging it, working with professionals like Joan, working with professionals from Practice Green Health to determine what those metrics are going to be and how you're going to measure them are critical. What we strive to do through the Tree Campus Healthcare Program is celebrate those successes, share those successes within the peer community to make sure that that information is available for you as you're trying to make your arguments and your compelling cases for acting in your communities.
Thank you. And so we're almost at 3 o'clock. So I just want to thank all the speakers for sharing your powerful work that you're doing to support climate solutions through trees and plants. Thank you. I want to thank all the attendees for joining us today. It's wonderful to have so many collaborators and champions doing this critical work. We will send out answers to the questions we didn't get to. We will also be providing a recording of the event as well as a PDF of the slides to all session registrants. And I would encourage you to join us next week on Wednesday, October 7th at the same time for our next Clean Med session, which is called Resilience from Farm to Plate. And it's to learn how we can build climate smart food systems that support community health. So thank you for attending and have a great rest of the week.